Okay.
All right. So first things first, let's start, like we always do. Do you mind saying your name and your title with the county for me?
Yeah, it's Andy Brown. I'm the Travis County judge.
Great. So tell me what really led up to this decision for the mask mandates. And I know I read the press release, but can you explain exactly what it does?
Yeah, sure, absolutely. So public health officials, doctors locally, hospitals locally have been asking for us to do this. And most importantly to me, parents of kids who are about to go back to public schools have been asking us to do this. They need our help, especially the hospital workers and the doctors. They're exhausted, and this is frankly the right thing to do. So, as the head of emergency management for the county, which is what I am as the Travis County judge, I have a responsibility to put the health and safety of kids and all people in Travis County first. And so that's exactly what we've done here today. And we've ordered that, any school that is physically located within Travis County, any public school or public charter, has to require kids, faculty, staff, anybody in the schools to wear a mask starting, tonight at midnight, but in effect really tomorrow. And so I think that's most relevant to like Pflugerville ISD, where kids actually will come back in person tomorrow. The kids, the educators, staff, everybody in the school will be required to wear a mask.
We've already seen some backlash, at least on social media, from Governor Abbott regarding mask mandates. And are you concerned at all about any backlash from the state level?
The thing I'm concerned about is that we're sending our kids back to public schools without the ability to get a vaccine. Kids 12 and under still cannot, or under 12 still cannot get vaccines. And so we're sending them to an indoor environment where they're going to be, fairly close to one another. And we're in the middle of a surge like we have not seen before with this Delta variant. Our hospitals are strained. The number of people in the ICU is at extreme levels. There are kids that are in ICUs, kids on ventilators. We need to do something about it. And frankly, I'm not, if Governor Abbott and our Attorney General, Ken Paxton, want to sue over me and the school districts across Texas, from Dallas to Houston to Austin to Spring ISD, if they want to sue all of us over trying to protect the most vulnerable kids in our society, then, let them do it.
Have you talked with those other jurisdictions, the ones that you just mentioned, regarding this decision and how they came to that decision, earlier this week?
Yeah, I've talked to most of the school districts here in Travis County, and then some of the ones around the state as well. And I think we all feel, frankly, the same way, that this is just the right thing to do. We don't believe that, frankly, the governor has the legal right to tell a local school district that it does not have the right to protect the lives and the safety of kids within its care. And so, yeah, I think there's a broad consensus across the state that the governor has overstepped his bounds in trying to prevent local authorities and local school districts from keeping kids who are under 12 years old and can't get vaccinated as safe as possible.
Despite the vaccination rates and just the number of vaccinations that we've had across Travis County, is this a sign of things continuing to go where we were in 2020? Maybe not so much as, quarantining everyone or anything like that, but kind of going in that direction?
Yeah, I mean, I think honestly, the thing that Governor Abbott and I have in common is that we want to vaccinate everybody in the state of Texas as quickly as possible. And if you look at our neighbor, El Paso, who frankly has a higher vaccination rate than Travis County does, because they were hit very hard with COVID. And I think everybody there understood how important it was to get vaccinated. They have a rate of over 70%. They currently have, lower infection rates, lower positivity rates than I believe any other major urban area in the state. So I think that should be a good beacon for all of us and a good goal for all of us, that we need to get our community vaccinated. The whole community, within every zip code and every neighborhood, we need to get over 70% and likely over 80% of the population vaccinated. And so until that is done, I'm going to keep working with Republicans, Democrats, whoever it is, the governor, TDEM, neighboring counties, to try to get everybody vaccinated, because frankly, that's the only way we're going to get out of this cycle of variant spreading and things getting worse for everybody.
Have you had any conversations with people who are not for the mask mandates? We've seen a lot of teachers, not so much teachers, but parents and other people who don't want these mask mandates as the school year is starting.
You know, I'm aware that there are people out there, but the communications into my office have overwhelmingly, and I believe unanimously, been from parents who are just absolutely afraid, frankly, of sending their kids back to a school environment where kids will not be wearing masks, especially in light of the fact that the Delta variant can spread not only among unvaccinated people, but there's, I believe, evidence that people who are vaccinated could still spread it. So that just underscores the importance of wearing masks, especially around unvaccinated children. Because I think the last thing that any of us want to see is, you know, large numbers of kids in the ICU on ventilators, or even worse as we go forward in these next few weeks. And the only way that we're going to be able to relieve the strain that our hospitals are currently under, that they're under today, is by getting people to wear masks to help get this spike down over the next few weeks. And then longer term, getting everybody vaccinated so that we don't get another one of these spikes again.
Because we've had these spikes, you've also seen a lot of event organizers postponing their events. Austin Pride announced it today. Blues on the Green announced earlier this week, and it was supposed to happen yesterday and today. When I saw these, I was gonna say, so when I saw these events, you know, popping up earlier this year, it's kind of like a light at the end of the tunnel, right or wrong. Do you see that light at the end of the tunnel feeling going away right now, or were we ever there to begin with for you?
Yeah, I think it just underscores the fact that, you know, we all kind of thought we were maybe near the end of the COVID pandemic, and this Delta variant has shown us that until we get to herd immunity, until the, you know, 70-80% of our population gets vaccinated, we're still vulnerable to this. And that's frankly just how viruses work. And so we need to stamp it out once and for all by working together and getting everyone vaccinated. We have teams of folks that have been working across, especially Eastern Travis County and East Austin, going to supermarkets, apartments, housing complexes, things like that, other events. And the one sort of bright spot in this is that more people have been saying, yes, I would like a vaccine. And instead of giving 40, 50 vaccines a day, these teams of people have been giving over 400 a day. And so, you know, I think people are realizing that if we want to get back to being able to see concerts, go to South by Southwest and ACL and Blues on the Green and everything that we love doing here in Austin, Texas, we're going to have to, first off, wear our masks for, you know, the next few weeks, maybe the next few months, till we get through this Delta variant, as unpleasant as that is for everybody, including me. And we also have to get our neighbors, our families, anyone who's not yet vaccinated, they just need to do it, because this is it's a surge largely in the hospitals of the unvaccinated. And we've got just, you know, I was there in the ICU a couple of weeks ago and saw that there was a 19-year-old in there, people up to age, I think 39, that were actually on this ECMO procedure, which is the very last sort of life-saving procedure that our hospitals have. It's very unpleasant. And the fact that there were such young people on that shows that everything has changed. The Delta variant is very different than the original version of COVID. It's hitting a younger population, but almost entirely hitting an unvaccinated population, at least as far as the ICUs and the hospitals are concerned.
That was going to be my next question. Is we're seeing the Delta variant now. Hopefully, when the Delta variant goes away, you know, and people are more vaccinated, then we're, you know, kind of really come out of this. But if there's another variant right behind that, do you anticipate keeping these orders in place? You know, I hesitate to say indefinitely, but, you know, it could be weeks, months, maybe longer.
Yeah, no, The only time period under which we would keep these mandates is until our local health authority, Dr. Walk, says we don't need to do them anymore. Until I mean, there is a broad consensus among the medical community that we need to mask up now, and the reason we need to do that is to prevent the spread of the Delta variant, and that's the only way we're going to get through it quickly. And so the CDC recommends what we've done today. Excuse me. The American Academy of Pediatrics recommends masking for kids 2 and up. So that's the way that we're going to get through this, is by, again, it's not pleasant, but we simply have to do it. That's simply a reality of what we're living in, is that we need to put masks on to stop the spread of this. And then we need to get ourselves vaccinated as quickly as possible.
Do you see a future of any sort of vaccine mandates?
I don't know the answer to that question. I think that once FDA approval comes for vaccines, that will open up to, hopefully more people being willing to take it. And I believe that, there are other vaccines that we've all taken growing up. I grew up here in Austin. There were, I believe, vaccines that were required for different parts of my life and different ages. And I think that once we get full FDA approval, that could just be part of it. And how we get a bigger part of our population vaccinated. So, I don't know what the future holds, but I do hope that everybody gets vaccinated.
Okay. I believe that's all my questions for you. Is there anything else that you wanted to add about the mandates that you issued tonight, or what it really means going forward?
Yeah, I think that, it's what we've done today by requiring masks in public schools across Travis County and across Austin is something that we are seeing happen across Texas, that people in school districts from Spring, Texas to Houston to Dallas to here in Austin understand that the science says we can't send kids who often aren't vaccinated or can't be vaccinated yet into indoor environments in group settings without expecting them to end up in the hospitals and the ICUs. So the way to prevent that most effectively right now is to mandate masks for our public schools here in Travis County and across the state.
All right, Judge Andy Brown, thank you very much for doing this. I appreciate it.
Yeah, thanks, Mike. I'll see you later.
Have a great night.
You too.